Hi, I'm Saima. I am the head trainer at CareCraft Academy. This is my series about real-life challenges faced in the health and social care sector that sometimes individuals feel afraid to disclose. So one more thing before we start. We will be maintaining confidentiality, and we have gained permission from providers to utilise these scenarios to raise awareness and improve practices. A customer made contact with CareCraft Academy in relation to Stoma Care Training. The customer had informed CareCraft Academy that they have a particular resident who's quite embarrassed to have his bag changed, for staff to document the level of fluid. The challenge for the customer here is that the client is quite embarrassed for staff to check the stoma site. He refuses during each session of personal care. Staff are reporting an odour in the client's bedroom. And furthermore to that, the matter hasn't been escalated, as the customer is quite unfamiliar with what action they can and should be taking. The resolution that we sought during training at that time, the customer was advised to contact district nurses, to make contact with that individual's allocated GP and have the site checked. The customer had informed me that once the GP had visited the resident, he asked for the resident to be taken to a hospital as he suspected infection. This then resulted in the service user being hospitalised for a number of days. He later returned in good health and good spirits to the care home. During the training, staff were advised on how to escalate matters, who to contact, and when to raise the alarm. The reason the client was quite embarrassed to show his stoma site is because he felt that staff were quite pushy. He didn't feel comfortable or confident enough at that time to show them his stoma site. Staff were provided with the values of a care worker in the industry, and they were reminded of how they need to communicate with each and every service user, and attitude was also taken into consideration. We carried out quite a few simulation activities during the training to ensure that staff were quite familiar with what it's like to be spoken to in a non-caring, non-empathic, non-compassionate manner. The provider has now reported that they have improved on their provision. They carry out spot checks on their workforce during the delivery of stoma care. And furthermore to that, management team also carry out weekly and daily checks on stoma site to further reduce the likelihood of any infections or any concerns regarding the stoma site itself. Let me know what your thoughts are. Leave me some comments below.